This mini lecture is going to be on attachment.
Okay, the early perspectives on attachment suggested that feeding was the primary context in which an attachment would form between a caregiver and a baby. And if that's the case, then who would be the most likely person to form that attachment, that emotional bond with the baby? It would be the mother. And so there were some important observations in the 1950s that tested this notion directly. Harlow raised rhesus monkeys with two artificial mothers. So the rhesus monkeys had in their cage with them a wire mesh mother, and the wire mesh mother had the food, and then there was a second mother, and the second mother was covered in terry cloth. And what you would expect to find, if this notion of feeding being the primary context of attachment development to be true, what you would find is that the monkey would spend most of its time with the mother that had the food. And as you can see from this picture, that's not the case. The monkey would spend most of its time clinging to the terry cloth mother and would only go to the wire mesh mother when it wanted to feed. And they would also do these um, these experiments where they would do sort of a social referencing paradigm, where they would introduce into the monkey's cage some moving object, a toy that sort of moved and made a lot of noise on its own. And what you would see is when that would enter the monkey's cage, the monkey would run and cling to the terry cloth mother because it was afraid. Okay, so indicating that there was some attachment formed with that terry cloth mother. So that directly refuted the notion of feeding being the primary context of attachment, that it's not really feeding as much as it's contact comfort, sort of feeling warm and secure. Now, for these monkeys, that contact comfort was not enough. When they were adults and reintroduced into their communities, they didn't do very well. These monkeys tended to interact in very odd social ways. They would either cower in fear from the other monkeys, or they would be unusually aggressive. And the female monkeys tended to not be very good mothers. They tended to be neglectful and abusive. So just having that contact comfort is not enough. What they also found is that if these rhesus monkeys had the artificial mother, but also were able to interact with their peers for at least the first few months of life, they did much better in terms of their social development down the road. So it's not just the contact comfort, you have to have some normal social interaction as well. Now, a second observation came from Renee Spitz's research with institutionalized babies. These were babies that were given up by their mothers between the ages of 3 to 12 months for varying reasons, and they were placed in a ward, an institution. And they observed what happened because, again, the idea is that the mother is this primary attachment figure. What happens when the baby separates from that primary attachment figure? And what they found is that these babies began to cry more often, they withdrew, they lost weight, they had difficulty sleeping, they essentially became depressed. So the initial thoughts were, well, this does support the idea of mothers being the primary attachment figure. But when they looked more closely at what was happening in the ward, in the institution, what they found is that babies typically were sharing a nurse with at least 7 other babies. And so what was happening was the babies were not really given the opportunity to form a new bond, to form a new attachment with somebody else, because they didn't have enough one-on-one interaction with another caregiver in order to develop that bond. And once they were given that opportunity, they were perfectly capable of forming a new bond, and their symptoms of what looked like depression went away. So again, this refutes that early idea that feeding is the primary context and that mothers would be the primary attachment figure. Now, we've talked before a little bit about ethological theory. We talked about Lorenz's work with geese and the idea of imprinting. So hopefully you remember that. If not, you can go back and listen to that slide from the lecture on theories. And we talked a little bit about how Bowlby took these ideas and applied them to human infant caregiver attachment. And the idea here, remember, is that the baby comes into the world with these inborn behaviors that Bowlby referred to as signaling behaviors, that they are social signals. So they come into the world being able to smile, for instance, being able to cry, being able to grasp. And those kinds of behaviors signal the parent to approach and to care for and to interact with the infant. And so that helps to facilitate that bond. In turn, the caregiver has these sort of natural reactions to the infant. So a caregiver has sort of a natural reaction to the infant crying, and they want to approach and care for that infant. And so all of that ensures that the baby is going to be fed, that they're going to be protected from danger, they're going to be getting enough stimulation and affection necessary for healthy growth. And so that's the idea here with human-infant attachment. Now, what Bowlby did is he developed a theory of attachment development. So Bowlby suggested a sequence of attachment development that it occurred in stages, and that in the first stage you have pre-attachment. This is from 0 to 2 months, and it's pre-attachment because the infant is not yet attached to any one person. They're displaying those signaling behaviors that help bring the newborn in close contact with other humans. But once an adult responds, no matter who the adult is, the infant responds to that well. They're typically comforted. They will be soothed by that caregiver, and they're not yet discriminating from one adult to the next. They're not minding being left with an unfamiliar adult at this point. Although there are some precursors to attachment, therefore the pre-attachment. Okay, so we've already talked about how the baby can recognize their own mother's smell, they can recognize their own mother's face, their own mother's voice, but they're not yet attached to her because they don't mind if someone else cares for them. In the second stage, you have attachment in the making, and this is from 2 to 7 months. And here what we see is the newborn is starting to the infant is starting to differentiate between their caregiver and a stranger. They're not yet protesting being left with a stranger, but they do respond a little differently to their familiar caregiver than they do to a stranger. So for instance, they will smile more genuinely at the caregiver than they will at a stranger. And you can measure this. There's a whole facial coding system that's been developed, and you can look at the specific muscles in the face that are being used when displaying a particular facial expression. And what you see is the infant displays what's called a Duchenne smile, which is a very genuine smile. They use more muscles in their face. And with the stranger, they will smile as well, but it's not that Duchenne, that genuine smile. It's not as genuine. And so they are differentiating and showing slightly different behaviors, but they're still not going to protest if they're separated from their parent. So attachment is underway, but just not established yet. It's in stage 3 that we do have clear-cut attachment. This is typically anywhere between 7 to 24 months, but we start to see these behaviors typically by 7 months of age. And what denotes the attachment is you have fear of strangers, you have separation anxiety, where the infant does not want to be separated from that primary caregiver. They cry and get very upset, typically, when separated from the caregiver. They use that primary caregiver as a secure base for exploration. So you'll see infants, once they're independently mobile, they'll often sort of be exploring the environment, but they will very regularly check in with that primary caregiver, whether they look to the caregiver and smile, or they kind of go back and forth between their toys and the caregiver. They're using that parent or that caregiver as a secure base to safely explore the environment. The other thing, according to Bowlby's theory, that happens during this time is we develop what's called an internal working model. And an internal working model is a mental representation of what relationship is, right? So this is our first very important relationship in life. It's our first emotional bond with somebody else. And from that first relationship, we develop this internal working model of what relationships are to be. And according to the theory, that internal working model then influences your development of relationships with all others in the future. So that's pretty heavy duty in terms of the importance of attachment in this theory. We'll talk about whether that's the case down the road, or whether there's good evidence for that down the road. in this lecture. And then later in development, from 24 months on, you have what's called a reciprocal relationship, where it's also referred to as a goal-corrected partnership. Basically, these are terms to say that the relationship is now two-sided. That it's not just how the parent is responding to that newborn. There's more give and take between the child and the caregiver. There's more negotiation between the two. So it's more of a two-way relationship than we have at earlier phases. Now, one question that has come from this theory is whether infants and caregivers can develop attachments that are of different quality, right? So, do some infants and caregivers have an attachment relationship that's of a more positive quality than others? Okay, and so this is what Mary Ainsworth studied. She thought that securely attached infants would use the parent as a secure base and would react in very particular ways when separated from that primary caregiver. And the way that she assessed this was with a situation that she designed, and it's called the strange situation procedure. And so it's 7 3-minute episodes, and here it's listed as mother and baby because, frankly, a lot of the research has been done with mothers. We need more research with fathers, you know, in general in the field, but especially with regard to attachment. But what you have are these episodes. So that first you have mother and baby in a room. There are toys, and what you're looking for in this first segment is the baby using the mother as a secure base for exploration? Are they exploring the toys in the room but checking in with mother? And then a stranger comes into the room, and you look to see how the baby reacts to the stranger. And then the baby is left with the stranger in episode 3. And so you're looking again to see, is the baby upset that the parent has left? How are they reacting to that? If they are upset, is the stranger able to comfort the baby? And again, what are they doing? Are they still exploring the environment? Have they noticed that mother is gone and that stranger is now caring for them? What's going on? And then in episode 4, this is a reunion episode. So the mother comes back into the room, and you're looking to see what the baby does. Does the baby approach the mother, wanting to be picked up? If they do, are they soothed by the mother or not? And then you have a few more episodes where then the baby is left by themselves again, and then a stranger comes in, and then you have another reunion episode. And so, based on this assessment procedure, Mary Ainsworth came up with these different types of attachment. Before we talk about the different types of attachment, what I want you to do is look at this YouTube clip that shows basically, a very short version of what the strange situation looks like, and you can observe what the infant does in relation to the parent and in relation to the researcher that's in the room. Okay, so what kind of attachment do you think was being displayed in that video clip? Well, let's talk about the different types of attachment. So, what Mary Ainsworth found in her research were these first 3 categories. The disorganized category was added later by other researchers, but Mary Ainsworth's initial findings involved these 3 categories. So she found that 65% of the sample could be classified as secure, and a secure attachment is where the baby does use the parent as a secure base. When separated from the parent, they usually will cry, and when they're reunited with the parent, they immediately seek contact with that parent, and they're easily comforted by the parent. So hopefully now that you hear that description, you realize this is definitely a secure attachment in the video clip that we saw. Okay, then 20% of the sample was avoidant, and or you can call it insecure avoidant. So the next two attachment types are insecure attachment types, and you have avoidant and resistant within that. So the first one, avoidant, what you see is that the baby tends to be unresponsive to the parent before separation. So they're not really using the parent as a secure base for exploration. They're exploring the toys, but they're kind of ignoring the parent, not checking in with the parent. And when they're separated from the parent, they're really not distressed. They seem not to notice really that the parent has left the room and that they're no longer there. And when the parent comes back, in that reunion episode, they either avoid the mother altogether or the parent altogether, or they're really slow to greet the parent. And then the second insecure type is the insecure resistant or insecure ambivalent. And so what you see here is the baby is really preoccupied with the parent before separation. So they're not actually exploring the environment. They're not using the parent as a secure base for exploration. They're preoccupied with the parent and clingy with the parent. And when they're separated from the parent, they do become very upset. And during the reunion episode, it's interesting because they actually seem to be angry with the parent and they display these resistive behaviors. They're not very easily comforted, so they might be picked up by the parent, for instance, and then kick their way back down, right? Or turn away from the parent, or just they are displaying behaviors that look like they're angry with the parent. So if you look at these first three categories, obviously not the whole sample fits in the categories. So this is always going to be an issue whenever you're trying to categorize human beings. The fourth type came in later, as I said, and it's the disorganized or disoriented type. And these babies tended to show just a variety of confused and very contradictory behaviors. So for instance, they might, let's say during a reunion episode, start to approach the parent and then they freeze in an odd posture and stay that way for a long time. Or they would look away while being held by the parent. Or they would just have a really depressed gaze, or they would cry out unexpectedly after having calmed down. So they were just showing these really odd behaviors. And it turns out that children who are neglected or abused or have parents that abuse alcohol or drugs tend to be more likely to fall in this category than others. So what are the factors that affect attachment security? Well, we've already seen this, right? Just having the opportunity for attachment. So that research that Renee Spitz did with those institutionalized infants showed that the depression that those infants developed was not just because they were separated from their own mother, but because they didn't have the opportunity to form a new attachment. Now, a first attachment can develop as late as 4 to 6 years of age, right? We've talked before about how it's ideal. There's a sensitive period for attachment, and it's best if you can develop your first attachment in the first year of life. But you can develop a first attachment as late as 4 to 6 years. But if you have a late developing attachment, then you're at greater risk for other emotional and social problems. So, for instance, children who are in that kind of a situation tend to need excessive adult attention. They tend to be overly friendly to unfamiliar peers and adults. They have more difficulty making friends. A second factor that affects attachment security is, of course, the quality of the caregiving. And what we see in those secure attachment relationships is that the parents are responding much more promptly to infant signals, and they're responding much more sensitively. They're showing more positive emotion, they're handling their babies very tenderly and carefully. And they tend to show this interactional synchrony. If you were to watch a parent and a baby who have a secure attachment interacting, and let's say you videotape them and you even slow down that videotape, it almost looks like they're doing this kind of dance with one another. They're just very much in sync. There's a very smooth flow and give and take to their interaction. On the other hand, if you look at insecurely attached caregivers and infants, these parents tend to be awkward in their physical contact with the babies. It's almost like they don't really care for physical contact themselves, so they handle the baby kind of awkwardly. They tended to behave a little bit more insensitively when they're meeting the baby's needs, and you don't have that interactional synchrony. Infant characteristics are another factor, but it's kind of hard to know exactly what to make of these these results. So, for instance, we know that securely attached babies cry less often and they're more easily soothed. And we know that insecurely attached babies cry more, they show more anger, and are less easily soothed. But it's not clear, right, if these differences are because of parenting and the attachment relationship, or if it's because there are differences in the infants in terms of their temperament. Right, so temperament could be a part of this, but there isn't great evidence for this. The evidence is mixed about the link between temperament and attachment. Another thing that we see is those insecure, disorganized attachments tend to occur at a higher rate among infants with special needs, in addition to those that are perhaps abused or have parents that abuse drugs and alcohol, like I said earlier. If the infant has special needs, like they're a high risk premature baby, or they have Down syndrome, or a later diagnosed autism, or some physical disability, these infants tend to be more likely to display those insecure, disorganized attachments. Um, and so, right, infant characteristics can play a role, but we still need more research on that. Family circumstances can play a role. So think about, what is the structure of the family? Are there two parents at home? Is the child an only child? Are there lots of children in the home? Is one of the parents unemployed and therefore the household is stressful? Right? You can imagine many different things that would fall in that category. And then the last one is the parents' internal working models. So we talked about internal working models before, right? That you have this mental representation of what relationship is. And there's some evidence that the parents' own attachment status, which is typically assessed in adulthood and retrospective, and that may not be the best method, but their own attachment status is correlated with the attachment status that they then have with their own offspring. Okay, and then you just want to remember that attachments can occur with multiple others, as we've already talked about in different ways. So it's not just attachment with mother, but you can also have an attachment with fathers and siblings and grandparents and professional caregivers. We'll talk a bit more about fathers next, and a little bit about the factors that affect attachment development for those children that are in daycare. Okay, so fathers obviously are perfectly capable of forming an attachment with their infant. And the same kinds of factors that are important in father infant attachment, like sensitivity, warmth, all of those things matter for fathers as they do for mothers and infants. And in addition to that, fathers tend to play a unique role in children's social and emotional development because fathers really are the playmate of infants in our society. Mothers are more of the caregiver. And so, mothers are attending to the child's needs in terms of feeding and bathing and changing and all of that in general. And fathers are very much involved in playing with the infant, and so they play a special role there. And the kind of playing that they engage in is very active, very dynamic. You see fathers throwing their infants up in the air and doing that kind of very arousing physical play with infants. And that, as it turns out, seems to have an important role in emotional development because it's giving the child experience with very arousing emotional interaction and then needing to calm down from that after. And so fathers do play a unique role. All right, so what about children that are in childcare? There's nothing in the research that suggests that being in childcare and daycare prevents you from forming a good quality attachment. What happens to the attachment between the caregiver and the infant depends on the initial attachment quality, right? So, presumably, the infant and the caregiver have had some time together before the child enters childcare, and the formation of that relationship, at least as it stands, initially is going to determine what happens after that point. But being in daycare in and of itself doesn't prevent the formation of an attachment between infants and their parents. They tend to show similar patterns of attachment in terms of the percentages of infants who end up in a secure versus an insecure attachment. It looks the same whether you're in childcare or not. Now, family circumstances can play a role. So, what is the reason for entering the child into childcare, right? That can have an impact on the relationship between the parent and the child, and also the quality of the child care that the child enters. Um, so the quality of the child care is important to consider. What is the ratio of caregivers to children? What kinds of activities do they have children participating in? Are children engaging in what's called developmentally appropriate practice? In other words, do they have infants engaging in the kinds of things that are appropriate based on the child's age and level of development? Now, one thing that we do know is that the amount of time that is spent in daycare can have an impact. Children that are in full-time daycare that begin full-time daycare before the age of 1 are more likely to be classified as insecurely attached than infants of non-employed or part-time working mothers. However, this is correlational, so we're not really sure how to explain that relationship, right? So is it that being in daycare full-time prior to age 1 is what's causing the insecure attachment, or is there something about the family circumstances or the parenting behaviors of the parent that contributes to that insecure attachment and also contributes to placing the child in child care? It's hard to know what's causing that relationship. Now, in terms of quality of care, just to go back to a couple of things, one of the aspects of quality of care is, do you have staff that are consistently present, or do you have a high turnover rate? In other words, do you have staff that start working and then quit, and then so you have new people coming in all the time? Unfortunately, in the United States, we tend to pay people who work with the youngest children the least. Okay, so the younger the child, the less the pay. So child care workers get paid very little, and as a result, you do have a high turnover rate. Children are going to be more likely to form a relationship and possibly an attachment with staff that are consistently present and have been around for on a long-term basis. That's who children are going to seek out and who they're going to form their relationships with. So that's something to consider. It's interesting that in our society we don't place a high value on employees that are working with very young children. Okay, so does your attachment classification matter for later development? So does the bond that you have that would be assessed in infancy and toddlerhood by the strange situation have any bearing on your skills cognitively or socially later on? And it turns out that it is related to behaviors later on. So secure attachment is related to more positive outcomes in both preschool and middle childhood. So let's look at a couple different areas. In terms of cognitive development, the research suggests that having an early secure attachment is related to having more complex exploratory play at age 2. So if you think about that, think about using the caregiver as a secure base for exploration, right? If you have a secure attachment, you're going to be more likely to be using the caregiver as a secure base for exploration, and in turn, what that means is that you're going to be exploring the environment more. And so that's going to have consequences for cognitive development because of the experiences you're getting in the environment. Also, what you see is that secure attachment is related to less frustration and less negative affect when solving complex problems. So children who have a secure attachment look like they have a little bit more frustration tolerance when it comes to solving difficult problems. And children who have secure attachments also engage in more symbolic play. Symbolic play is using mental representation, which we talked about before when we talked about Piaget's theory, so that you can use one object to represent something else. As an example, we see more of that in children who have a secure attachment. By age 7, so looking at middle childhood, teachers rate children with secure attachments as being more attentive in the classroom, having a more secure sense of self, and also having higher grades. So there are some connections there. In terms of social development, teachers rate securely attached children as more positive and having better social skills overall. You also see from research that securely attached children tend to be less aggressive, they tend to have more friends, they tend to be more popular, they tend to depend less on adults, they tend to have higher self-esteem, and are more likely to form close friendships with other securely attached peers. One study in particular took children that had participated in an attachment study early in their development, in infancy and toddlerhood, and gathered them all up and sent them to a camp together. and was really interesting because observations indicated that the kids that had been classified in infancy and toddlerhood as being securely attached ended up making friends with other kids who were also securely attached, and that those who had insecure attachment classifications tended to gravitate towards one another. So, what does this mean? What it means is that what what happens in infancy is going to be reinforced possibly by the kinds of social behaviors and interactions you have later on in development. Also, what we want to think about is that it's not just your attachment classification in infancy and toddlerhood that kind of sets the stage. It's not as though, okay, you have an insecure attachment in toddlerhood. That means that you're now on this very specified path of development and you're not going to veer from that. No, what it means is that there's probably a continuity of caregiving that links infant attachment and later development. In other words, the kinds of behaviors that foster secure attachment, if those are present, if the caregiver is engaging those in those behaviors in infancy, they're probably continuing to engage in that same level of caregiving throughout the child's development. And so it's not so much that classification in infancy and toddlerhood, it's that that kind of caregiving continues throughout development, and that's why we see these correlations between that attachment classification early on and later development.